Rippey is an initiative to empower the next generation of health practitioners to provide better health outcomes for our rural populations.
We focus very heavily on the rural population because that is a very vulnerable population and we recognize the need. We run into food deserts, first of all, just basic access to care. A lot of times people have to travel hours to get quality care.
Maybe they can't drive anymore, so then it's hard for them to actually get to an appointment, or there's not a safe place on their land for them to walk around. It's not like there are sidewalks on country roads.
The primary goal of the Rippey program is to introduce students to these communities, give them a chance to get immersed in these communities in the hope that they will love it and return to practice once they graduate.
The components of Rippey are the didactic piece, the clinical immersion, and then the quality improvement project, as well as the Rippey champions.
Our Rippey champions are our faculty members from all of the disciplines represented in our Rippey program, and they are, I would say, the experts in their field, and they're lending their expertise to our students. The students go into the sites, they identify a need, the site kind of identifies their need and tells the students what they're looking for. The students develop a plan, give a pitch to the faculty and staff at the sites, and then they work on implementing that plan.
I took the immersion in the spring and used what we learned during the didactic piece the semester before in our immersion as we did a needs assessment of the environment we were in and a gap analysis to determine where we could most help. It was a brand new experience. It was outside of a hospital, a small town, farm town. You didn't have a grocery store on every corner, long dirt roads. It was just a different picture than you would see being in a city.
The class was definitely the foundation to be able to work with the community partners that we had in the field experience. I mean, it really provided us a framework to be able to really think about how we were going to help that particular organization reach their goals. We were assigned to help Chatham Hospital develop their new low-risk birthing unit. A significant number of the population that they were going to be serving was either uninsured or had Medicaid. There was also a very large Spanish-speaking population, so it sort of showed that there has to be a good cultural perspective taken into account when developing the unit, and making sure there's well-vetted interpreters and making sure that midwives were able to help the families and meet them where they are. Chatham Hospital was a really great opportunity to put those skills into practice and be able to work out some of the kinks that come with learning from a classroom and then having to apply it in real life.
The Rippey program started with 9 health professions represented across the UNC campus. They come in and all of the nursing students sit with the nursing students, all of the dentistry students sit with the dentistry students, and then by the end they're sitting with their interprofessional groups and they're learning and talking to each other, which didn't happen before.
We would go through a patient scenario and then go around robin around the group and talk about how myself as a nurse, what would I prioritize first for that patient. It was very insightful to be able to hear from other professions what they felt was the priority based on their clinical experience for that specific patient.
That was the first time that I got to sit down and really talk with everybody and really ask them, what do you do? What would you like us to know about your profession? And what can I do to help bolster that relationship and make it more effective for the communities that we're working with?
What you may not find as an important factor for someone's health could actually be a huge factor that you don't have the official training to really understand why it could be such an important factor. As a pharmacist, we specialize in medication management, and especially within an older population, we really assess medications that could have a potential falls risk. However, we can change medications as much as we want, but if we're not assessing a patient's risk for falling based upon where they live and the physical barriers that they encounter, such as loose rugs or the ability for them to ambulate in and out of their home, there's only a limited impact that changing a medication regimen can really have. Having an occupational therapist on the team was an integral part of making an impact on that patient's life.
Trying to fight it alone isn't always the best option because it's a big problem that takes a lot of hands on it. to make a difference. And so that was probably the main thing I took away from the course, is being able to advocate for clear communication across different professions and learning how to do that effectively.